स्टार्ट झालंय. हां, ॲक्च्युली ते नेटवर्क इश्यूमुळे थोडा प्रॉब्लेम झाला. हं. Good afternoon, student. There is some network issue. That's why the lecture is delayed. So, in the yesterday topic in the orthopedic, we was learn about the brief anatomy of the skeletal system, then organization of bones and the types of the bones, the function of the bones, that is protection of vital organs, support to the body, hemopoiesis, movement and locomotion, and the mineral storage. Then we was learn about the development of the bone, that is bone development start as a condensation of the mesenchyme. Later a cartilaginous model developed. Then there are two types of the ossification, that is endochondral and membranous, and there are three types of the bone cells, that is osteon, medulla. This is a bone cross section showing its internal structure. Medulla, cortex, and then the general structure of the bone, that it contains epiphysis, diaphysis, epiphyseal line, epiphysis. This is the calcaneus bone. This is the medullary canal, and this one is the cortex. Then metaphysis and diaphysis. So remember, part of the bone contains epiphysis, physis, that is growth plate, metaphysis and diaphysis. Then the organization of the bone. So there are total bones of 208 in number in our body, with 80 bones are axial skeletal and appendicular skeletal contain 126 of the bones. So in that there are the many types of the bone, that were long bone, short bone, flat bone, irregular bone and the sesamoid bone. So this is a diagram of the types of the bone showing, that is a flat bone, that is pelvic bone, then vertebrae, that is the example of irregular bone, and this one is a long bone that shows metaphysis, diaphysis, metaphysis and the epiphysis. Then foot is an assembly of the short bones of the various size that shows tarsals, metatarsals, phalanges and the sesamoid bone. So, types of the bone, remember that long bone, short bone, flat bone, irregular bone, sesamoid bone, and the above bones are arranged in two groups, that is axial 80 bones and appendicular is 126. So, in that we was learned that bone in axial skeleton contains skull, 8 cranium, 14 facial bone, and in the vertebral column 7 cervical, 12 thoracic, 5 lumbar, 1 sacrum, 1 coccyx, 1 sternum, 24 ribs, 1 hyoid. Ear ossicles are malleus, incus 2 and stapes 2, so total are 80. Then the bones of the appendicular skeleton, which contain a shoulder girdles, that is two clavicle, two scapula, upper extremities in that two humerus, two ulna, two radius, 16 carpals, 10 metacarpals, 28 phalanges, hip girdle, and ops coxa artery. So, in the lower extremity, there are two femur, that is right and left, two fibula, two tibia, two patella, 14 tarsals, 10 metatarsals, and 28 phalanges. So, totally 126 bones are present in the appendicular skeleton. So, when we see the diagram of a skeletal system, in that we was learned about that this is a frontal bone, this is one is a parietal, this is a temporal bone, this one is a sphenoidal notch, this is a spinomaxillary notch, this is a maxillary frontal process, this one is maxillary frontal process, this is zygomatic bone, this is the mandible, this is the mental foramen of the mandible, this one is a maxilla, then this is the infraorbital foramen, this is the zygomatic bone, this is the sphenoid bone, this one is a nasal bone, just above that there is an internasal suture, then there is internasal suture, just above that there is a supraorbital foramen, and there is a temporal bone, and this one is a coronal suture just above the temporal bone. Then this is the seven cervical vertebrae. Okay, this one is the first rib, this is a clavicle, this one is a manubrium of scapula, this is the acromion process of the scapula, then this is a coracoid process, this is the greater tubercle of humerus, this is the lesser tubercle of humerus, this one is the scapula, this is clavicle, this is the first rib, and this is the second rib, third rib, this one is the fourth rib, this is the sternum, this is the fifth rib, sixth rib, this is humerus, this is the seventh rib, and this is the eighth rib, this is the ninth rib, tenth rib, this is the xiphoid process of the sternum, this is the 11th rib, and this is the 10th rib. So, this is the humerus, this is the ulna and radius, this one, this is the anterior inferior iliac spine of a pelvic bone, this one is the greater trochanter, this is the pubic symphysis, this is the ilium, this one is the sacrum, this is the intervertebral disc, this is the medial epicondyle of humerus, that this one, and this is the lateral epicondyle of the humerus, this is ulna, this one is the radius, and in the carpals there is a lunate bone, triquetral bone, scaphoid bone, capitate bone, trapezoid bone, and trapezium bone. And in the pelvis there is a ischium bone, this is the ischium, this is ilium, this is sacrum, this is the pubic bone, this is the anterior inferior iliac notch, and this is the femur. In the femur there is a greater trochanter, then this is lesser trochanter. Okay, this one is the femur. And in the hand there is, these are the carpal bone, metacarpal bone, and the phalanges. So this is a patella, this is the medial epicondyle of the femur, and this is the lateral epicondyle of the femur. Below that there is a lateral condyle of the femur. Hello, हाँ बोला. हा बोला. बरं. कधी आलेत का तुम्ही क्लिनिकमध्ये? मग थोड्या वेळाने या, माझं लेक्चर चालू आहे ऑनलाईन. ठीक आहे, 4 वाजता या. हो चालेल. चालेल ना, दाखवलं तरी 5 मिनिटं. ठीक आहे. So this is a tibia. This one is a fibula. This is the head of the fibula. This is the internal tibia plate. This is the intercondylal eminence, and this is the head of the fibula. This is the tibia. This is the tibial tuberosity. This is the medial malleolus, and these are the tarsus, metatarsus, and the phalanges. So this one is the lateral malleolus of the tibia. So this is all about the organization of bone, that is the axial and appendicular skeleton. So next topic is the joint. A joint exists where two or more skeletal components where bone or cartilage come together to meet. And without a joint in between the bones, the whole body would be rigid and immobile. So the existence of these joints make the movement of the body parts possible. And joints are classified into the three major groups. That is, first one is a fibrous joint or synarthrosis. These are the immovable joint example sutures of the skull. In these there are three varieties. First one is the seamlessness. Seamlessness is characterized by a dense fibrous membrane that binds the articular bone surfaces very closely and tightly to each other. For example, there is a distal tibiofibular joint, and in the sutures, the two sutures are found in the skull. Here, the adjoining bone margins are united into the rigid jag interlocking process. For example, sagittal suture of the skull and gomphosis. Here, a conical peg or the projection that fit into a socket. For example, teeth and socket of jaw bone. So these are the different types of the joint. First is the hinge joint. Here, the movement takes place around the horizontal axis. For example, elbow joint. So this is a hinge joint. In that, we can see how the movement is take place around the horizontal axis. And pivot joint. This is shows the in the radial head, and this is the annular ligament. So here the movement takes place around a vertical axis that permit a rotation, like a atlantoaxial joint. Third one is the plane joint. So this is an example of the plane joint where the radius is attached to the carpus. This is a ellipsoid joint diagram. In that we can see how the radius and ulna are attached to each other. That this one is a ellipsoid joint type. Then fifth is a saddle joint. Here the articular surface is concave in one direction. That is this one, and the convex in the other, while the articular surface of the opposing bone exactly opposite. See that this articular surface of exacting bone is exactly opposite. So this is called as a saddle joint. For example, carpometacarpal joint at the base of the thumb. So uh, in the first, this is the first metacarpal and this is the trapezium bone, shows the saddle joint. Then bicondylar joint. In this, an oval condyle fit into the empty socket or cavity. For example, a radiocarpal joint. that this is a bicondylar joint, okay, and in that there is a oval condyle fit into empty socket or the cavity, for example a radiocarpal joint. Then ball and socket joint. So in this, hello, हो बोला. हो, मी माझं लेक्चर चालू आहे ऑनलाईन. मी सांगितलं त्यांना थोड्या वेळाने यायला, 4 नंतर. ठीक आहे. So next is the ball and socket joint. In this, a ball-shaped head of one fit into a concave socket of the another one. So this is this is a ball and this is a socket. So this is a ball that head of the femur is attached in a pelvic bone as a ball, and this is a socket. So this is a ball and socket joint. Then cartilaginous joints or the amorphosis, that these are slightly movable joints with either hyaline or the fibrocartilage in between. The two varieties are described, and that is synchondrosis, in that here a hyaline cartilage is pulsed in between, if for example the articulation between the rib and the sternum. So, articulation between the rib and sternum shows the hyaline cartilage. That is, they join with each other with the hyaline cartilage, that is synchondrosis. Then, symphysis. Here, a fibrocartilaginous is interposed in between and usually found in the midline of the body. For example, a pubic symphysis. So, in that case, when there is a fibrocartilaginous joint is interposed in between and usually found in the midline of the body, that is pubic symphysis. Then the synovial joint or diarthrosis, in that these form the majority of the joint in the body, and they have between the bones a synovial or joint cavity. They form the most mobile joint in the body and hence are more prone for the injuries. It consists of fibrous joint capsule that help to hold the articular bones together. So, the synovial membrane line the joint space and secrete the synovial fluid, and these fluids serve to lubricate the joint and provide nourishment for the articular surface. So, synovial joint is consists of a fibrous joint capsule, and that help to hold the articular bones together. So, the articular bones that hold together and synovial membrane that line a joint base, so secrete a synovial fluid, and these fluids serve as a lubricant. So, it acts as a lubricant the joint and provide a nourishment for the articular cartilage. And the articular cartilage is formed by a hyaline cartilage, which is a unique type of connective tissue formed by a specialized cell called as a chondrocytes. So this is all about the synovial joint. Then the types of the synovial joint. In that we will already see in the diagram that the hinge joint, pivot joint. First one is a uniaxial joint. These permit the movement in only one pace and one axis. In these there are the two types. First one is a hinge joint. Here the movement takes place around a horizontal axis. For example, elbow joint. So this is a diagram of a hinge joint, in that here movement takes place around a horizontal axis. Okay. And in the pivot joint, here the movement takes place around the vertical axis that permit a rotation. That is the atlantoaxial joint. This this is the pivot joint, that here movement takes place around the vertical axis that permit a rotation. So this is the vertical axis, and these axes permit a rotation, so it become a atlantoaxial joint, which is seen in a pivot joint. They biaxial joint. Here the movement occur in two planes and two axes that are at right angle to the each other. So here movement takes place in the two plane and two axes. So two types are described. That is firstly the saddle joint. Here the articular surface is concave in one direction and convex in other, while the articular surface of the opposing bone is exactly opposite. For example, a carpo-metacarpal joint at the base of the thumb. So this is a diagram of a saddle joint. That is in depth. Hello, हाँ बोला. हो बोला ना. अं, हो चालेल पाठवलं तरी संध्याकाळी 5 नंतर. ठीक आहे. हो हो चालेल. तब्येत ठीक आहे ना तुमची? ओके चालेल. ठीक आहे ठीक आहे येईल येईल त्याला यायचं तेव्हा बरोबर येईल. किती 12 डिसेंबर डेट दिली ना तुमची डिलिव्हरीची? हो चालेल करून घेऊ हो करून घ्या. Um, so the saddle joint here the articular surface is concave in one direction and convex in other, while the articular surface of the opposing bone are exactly opposite. So for example there is a carpo-metacarpal joint at the base of the thumb. So this is the first metacarpal and this is the trapezium. So in that there is a exactly opposite articulating surface, that one is convex and one is concave. Then next one is a condyle joint. In this, an oval condyle fit into an elliptic socket or the cavity. For example, a radiocarpal joint. So this is the diagram of a bicondyle joint. In this, oval condyle fit into an empty socket or the cavity. For example, a radiocarpal joint. So this is a radiocarpal joint. In that, no, actually this is a femur and this is a ulna, but in that in the bicondyle joint we can see in this diagram that oval condyle fits into the empty socket, that is for example a radiocarpal joint. The two varieties are described, that is, firstly a ball socket joint. In this ball shaped head of one fit into the concave socket of another one and of all the joint in the body. These provide the widest, most free range of the movement in almost any direction or the plane. For example, hip joint and the shoulder joint. So, when we study about the ball and socket joint, in these there is a ball-shaped head of one is fit into the concave socket of the another. That is, the head of the femur it acts as a ball, and the pelvic bone is acts as a socket, so it forms a ball and socket joint. Then a gliding joint. These are the numerous gliding movements occur in all planes. For example, joint between the carpal and the tarsal bones, and all the joints between the articular processes of the vertebrae. So, gliding joint are numerous. Gliding movement occur in all planes. That is, for example, joint between the carpals and the tarsals, and all the joint between the articular process of the vertebrae. So, carpal tarsal bones, that joint between the carpal and tarsal bone and joints between the articular processes of the vertebrae are the example of the gliding joint. So this is all about the brief anatomy of the skeletal system. So the next topic of orthopedic is the general principle of the fractures and dislocation. So this is a very important topic in the orthopedic, that is general principle of fractures and dislocation. In that, firstly, we will learn about the introduction, then definition, types of fractures, then approach to a orthopedic injury, investigation in orthotrauma, management of fractures, open fractures, then approach in compound fractures, approach to polytrauma case and the dislocation. So these are the many topics that we will learn in further. Firstly, the introduction. So it is not surprising if the bone break, but what is surprising is the fact that bone does not break more often, considering the amount of forces it is subjected to the everyday by the muscle action and load transmission. Hello? Anyone have problem?
No, ma'am.
Okay. So let us continue with the lecture. Okay. So bone has devised its own mechanism toward off the unnatural forces and keep itself intact. But only when the force is too large and occurs suddenly, as in the road traffic accident, that is the RTA, fall, etc. Or when the force is chronic and repetitive. That is, for example, prolonged standing, as in policeman in the nurse, etc. Or when the natural resistance of the bone is eroded by a disease process, for example, tumor and infection, etc. And that a bone succumbs to the insult and the break. And when it breaks, it is bound to injure and surrounding soft tissue like the muscles and ligaments. So firstly, when fracture is occurred. So fracture is not a common entity that it occur at anywhere at any due to the anything. But when the only force is too large and occur suddenly, that is in RT, that is in road traffic accident, or when there is a fall, and when a force is a chronic and repetitive, that is the prolonged standing. That is prolonged standing is seen in policemen, in nurses, in many people, etc. And when the natural resistance or the bone is eroded by a disease process, that is, it is due to the some disease like tumor or due to any infection, that a bone succumb to insult and death. So this result in a breakage of the bone, that is which lead to a fracture. And when it break, it is bound to the injury to the surrounding soft tissue like the ligament and the muscles. So, firstly, we will learn about the definitions of the fracture. So, fracture is a break in the surface of the bone, either across its cortex or through its articular surface. So, fracture is a break in the surface of the bone. It is either across its cortex or through its articular surface. Then dislocation is a complete and persistent displacement of the joint. So what is dislocation? Dislocation is a complete and persistent displacement of the joint. So it is a displacement of a joint, but it is a complete and persistent. Then it is called as a dislocation, and fracture is a break in the surface of the bone. And then subluxation. Subluxation is the partial dislocation of the joint. It is a very important in the clinical point of view that what is the strain, sprain, subluxation and dislocation and difference between the fracture. It is commonly asked in oral exam. So subluxation is a partial dislocation of a joint. It is partial. And when then there is a complete and persistent displacement of a joint, then it is called as a dislocation. Then, sprain is a temporary subluxation of a joint due to the ligament injury and the articular surfaces return to a normal alignment. So, sprain is a temporary subluxation of the joint due to the ligament injury and the articular surfaces return to the normal alignment. And strain is a tear in the muscle. So, tear in the muscle is called as strain. Strain is a temporary subluxation. Then, subluxation is a partial dislocation of the joint, and dislocation is a complete and persistent displacement of the joint, and fracture is a break in the surface of the bone. So, the bone can break within its soft tissue and envelope and may not communicate to the exterior, that is a simple or closed fracture, or it may rip through its soft tissue, or soft tissue itself may be damaged by external forces exposing the bone to the external atmosphere, that is compound or the open fracture. And in both the situations, depending on whether the force is direct, as in the direct impact in RTA, that is the road traffic accident, or indirect, that is through the muscle action. And depending on the amount of the force applied, the direction of the force, that is age, and other factors, that is different fractures pattern, are produced, and each one possesses a problem peculiar to its own. So, sprain is a tear of the muscle, and the bone break within its soft tissue and envelope and may not communicate to the exterior. So, there is a simple or closed fracture, and it may rip through a soft tissue. When there is an involvement of the soft tissue and damage by the external forces, then it lead to the and exposing a bone to the external atmosphere. That bone is exposed to externally, then it is called as the compound or open fracture. When it is not open externally, then this is a simple or closed fracture. And when it exposed externally, then this is a open fracture. So, in both the situation, that is in direct or indirect condition, depending upon the amount of force is applied, the direction of the force, that is the age and the other factor, and the different fracture pattern are produced, with the each one possess a problem peculiar to its own. If there is a severe RTA, that is the road traffic accident, may lead to the closed fractures when the bone is not exposed to external, but when there is a force is a hard and very strong, and which lead to the damage of the bone with the exposing the external atmosphere, then it lead to the open fractures also. So remember, forces required to break a bone could be large and sudden. For example, in RTA, that is road traffic accident, then repetitive, for example, a stress fracture, and trivial, that is a pathological fracture. So these are the three forces required to break a bone, that is large and sudden in RTA, repetitive in a stress fracture, and trivial, that is in a pathological fracture. So next is the types of the fractures. So simple or compound. This has been already explained, Rachel, that based on the extent of the fracture line, there are the two types of the fracture, that is incomplete fracture and a complete fracture. So incomplete involve only one surface or the cortex of the bone. That incomplete fracture is defined in its name that it is incomplete. That only one surface or the cortex of the bone is involved in that. And in the complete fracture, here the fracture involves both the cortices and the entire bone. So complete fracture shows that when there is a fracture involved in the both the cortex, and a complete fracture could be undisplaced or displaced. So, complete fracture it may be displaced or the undisplaced. Then the causes of for the displacement. That is, first one is the muscle forces, then the gravity, then obliquity of the fracture line and improper handling of the fracture. So causes for the displacement of the bone is muscle forces, then gravity, then obliquity of fracture line and improper handling of the fractures, which lead to the displacement of the bone. So this is a diagram of a simple fracture. Okay, and this is a diagram of a compound fracture. In that we can see that the two bones are fractured here with the great loss of the surrounding tissues, and in the simple fracture there is a single fracture but complete fracture with the loss of the surrounding tissue. So simple or compound fracture, it is a complete or incomplete two types, but this is a complete fracture and this one is also complete fracture, but it involves the two bones and it involves only one. Okay. So, the based on the fracture pattern, that is orthopedic trauma associated classification, in that there are the linear fractures, comminuted fracture, segmental fracture and the bone loss. So in the linear fractures, this could be transverse, oblique or the spiral, and any fracture that form an angle that is less than the 30-degree with the horizontal line is called as the transverse. An angle is equal to or more than 30 degree is termed as the oblique. So linear fracture could be transverse. There is a transverse, oblique or the spiral. They comminuted fracture. Here the fracture fragments are more than 2 in number and they are further subclassified into 50% communication or more than 50% communication. Butterfly shaped fracture are also included in this group and could be less than 50% or equal to or more than the 50%. So, next is the segmental fracture. A fracture can break into the segment, and the segment could be 2 level, 3 level, and longitudinal split or communicated. Then the bone loss. This could be more than 50% bone loss, more than 50% bone loss, or complete bone loss. So in many cases there are 50% or more than 50%, or in some cases there is a complete bone loss is seen, which is based on the fracture pattern. So types of the fracture based on the fracture pattern. That first one is a transfer. This is a A. This is the type of the fracture. In that transverse fracture we can see in this diagram. Then the B, that is the spiral fracture. In that we can see how the bone is fractured spirally. This is a diagram of a oblique fracture. In that we can see how the fracture shows an obliqueness. Then this is a comminuted fracture. In that we can see how the many fragments are occur of a bone. And this is last one, that is segmental fracture. In that we can see how the segment, that is more than one or two parts, are divided of a bone. So this is a type of a fracture on the based on the fracture pattern, that is transverse fracture, spiral fracture, oblique fracture, then comminuted fracture and the segmental fracture. Okay. Then atypical fractures. So firstly, a green stick fracture. It is seen exclusively in children, and here the bone is elastic and usually bent due to the bulking or bending inward cortex. Then a force is applied, and this is called as a green stick fracture. So remember, green stick fracture is very important for the exam point of view and also important in clinical. So it is mostly seen in the children and it is elastic and usually bent due to the buckling or the breaking in the burn cortex or when the force is applied. So it is called as a green stick fracture. Then the impacted fracture. Here the fracture segments are impacted into the each other and are not separated and displaced. C, that is stress or the fatigue fracture. It is usually